and went and get encoiled onto the leg. And this camel kept quiet, and it's heavier, the leg became heavier, he started hitting onto the wall, and got the whole leg damaged, as though somebody has taken a knife and went and just tried some slicing onto the legs. So then it was treated excellent wound. So this is how snakes that goes into the vicinity to where the animals are there. Okay, and then all the other symptoms, powerful, neurological signs, blood, urine in the blood, and label bleeding. Veterinary treatment, the general treatment is just keep quiet, we keep it very quiet, immobilize the area, and then we clean the area and then start to go into treatment. These are the clinical sciences we come see in the case of horses. It varies, but it includes pain and the swelling of the bite area. Swabbing of the tissues takes place very commonly. Dry bite with little venom injected can often cause mild signs later. Then the bite can be dangerous, and these are some of the symptoms you can see from the pain, swelling, coagulopathy, hemorrhage, cardiac disorder, shock, collapse, and then even temporary for that. The neurotoxic venom is the one that causes the paralysis process. And if it, in most cases the nose gets bitten, you know why? Most of the time it puts the head down, it gets bitten, and the nose gets swelled up, develops nasal swelling, and it undergoes respiratory distress. And then within the signs of envenomation that occur, within minutes or it can take many hours for the horse to die. So during the process, the veterinarian may not be able to know whether it's a snake bite or due to some other incidences. The first aid for snake bite with snakes are, we keep it calm, as I told you. No first aid treatment should be performed by the owners in the field, because some of the horse people, they like to do this old folk way of treating, and that we don't encourage, particularly it's not useful at all. Folk remedies are very harmful. Using suction device is not to be shown to be beneficial in the animal snake bite. The treatment varies according to the severity. You give in fluid, pain, medication, wound clean, wound care, antibiotics, tetanus as a prophylaxis, as well as antivenom. These antivenom, the tissue damage that takes place has to be recovered at time, is helpful in cases where there is very severe envenomation. And these antivenom that is being administered, it all is just one venom itself is sufficient to give beneficial effect. You look into the cardiac beat, look into the air passage, and then you must give a little of nutritional support. The other complications that arises are heart failure and kidney damage, and then cardiac failure can also occur after the bite, after a few months or even a few weeks later. The site of the bites in horses, I told you, the face, the leg, and then they develop problem. And in the term, the leg, what happened, the bite can also result into gangrene, which is not been treated well. But you can see that the horse will be surviving for some time. What not to do, that means what you don't do when a horse is bitten is as important as what you do. That's what I'm trying to say. Don't waste time in killing the horse or the snake to bring identification. The only venomous bite common in our country is from king cobras. Okay? We had one king cobra bite at the Turf Club in Sungei, and then the other two I told you in Langkawi. These are places where the horses have been kept, particularly in the stocks. Never apply a tourniquet to the snake bitten a horse, and as I told you, never. Don't employ any outdated therapy of cutting, like it's not Dr. Taldo told you how they do cutting and all that. Don't do that over the fang marks, and then don't try to suck out any of the venom. Accidental cutting of this may lead the venom to go and penetrate into the major blood vessels. And you'll avoid heat, don't use any heat application. Some veterinarians suggest to put ice, and some they do, some do not. But ice, prolonged time of putting ice will cause this frostbite. And don't use electric shock, like what Dr. said. There is a practice, giving electric shock on that, the horse can get up, etc. Don't do that, and then this will cause major problems to the animal. And other useless remedies are, some of them they put wax, some they cauterize the fang mark area, don't do, some give whiskey. They give whiskey so the animal can get up. This recalls me, I was taking what do you call lions from barbituric poisoning. So I had one senior vet came, why don't you give, he asked me to give the Guinness Stout. Give Guinness Stout to the thing will get up. This is quite common, drinking whiskey and beer, particularly fishermen, when they go and catch fish and then they get bitten, by the sea snake. When they come back home, they're very tired. They take a Guinness Stout or whiskey and they sleep. The next moment they find out they were bitten by the sea snakes. And then some use tobacco, they spit onto the wound and using NSAIDs and then carbolic acid, typical behavior should not do. But however, I have known some of our aborigines in the field situation. There's a particular type of and the student find difficult to open the door. Opening the door, she found a big Bitten. She jumped up and hit as high. She jumped up very high. He hit the ceiling, And there was also Bitten, and when the keeping rodents at Shana, university, they were looking for food. So one has to be very careful when keeping these rodents because of their food. And these are some of these house snakes, how Bittens can go and swallow very fish animal. Remember some 15 years ago there was a case in Muang where a man was being swallowed when he went to the kitchen booth, and then he was swallowed. This is a dog, this is a kangaroo. This is a sheep. And this is pigs. How they swallow the pigs. That's it. Thank you very much. Sorry for that slide. Then we could have given that now time for early discussion, and that has made my life so much easier. And the presence of Dr. Aldo here has also made it interesting and much easier. And just to quickly announce, to quickly inform, this will be an ongoing process in our uni faculty. There will be a forum somewhere on 30th of September this year. So you all try to come to the forum and you'll get a lot of information from Dr. Kaldo and other people from this society. And we will be having another big, snake bite conference. And slowly we will try to get some more things to be added with the help of Dr. Kaldo. I'm very fortunate to have met Kaldo some 6-7 years ago. I met him, and then he's not only a physician, he's also a biologist. He has got a lot of interest on snakes. He rears snakes, he do postmortem on snakes, he also breeds snakes, and he also do a lot of identification. And what the qualities he has made me to get married to him, in the sense that, we can get exchange information. And his wife also loves snakes. That's beauty, isn't it? Husband, wife, loving snakes, A lot of people, when they see snakes only, they get 99% of people, they see a snake fast moving like that. Okay, with this, thank you very much, Dr. Safarina. And my appreciation to Dr. Misato for the hard work to get this to be organized. Yes, with the hate. Why it goes with the hate? We talk about the Bitten. Now Bitten, they always goes for the hate first. Before they could swallow what happens, they get entangled in first. Then they get the heaviest part and get these jaws open as wide as possible to consume it first. The other part of the mechanism,
This is a similar feature as a bridge delivery or a normal delivery. Does that catch your imagination? Okay. But the thing is that it's not true that snakes always swallow the head first. Okay, uh, some snakes just go anywhere, but they do. They can position in terms of which angles, so they don't go melintang lah. They don't gigit perut saya dan makan perut dulu. They have to break me in two first, right? No, it doesn't do that, but it always go from either end. Either end.
People like lizards and the snakes in Selangor, the whole book. But we come to the bridge presentation.
Bridge presentation is a common presentation of delivery of elephant calves. Calf. It's not. Okay, any other question? Any students, any other questions? Because Abu is not here. Mana Abu? Tanya Abu, apa soalan? Because Abu sama.
How much is the average cost to treat animals being bitten by?
How much it costs to treat a snake bite in the case of animal? For a case of a cat, it will cost about 600 ringgit.
They don't use as much bile as human.
Say again?
They don't use as much bile as human.
They don't use as much
Bile.
bites. They don't use as much bites. It's only the supportive treatment. The supportive treatment and the hospitalization, and that is the cost of it. Not on the bile. Even the bile itself, it goes up to the bile 500 ringgit. 500 ringgit.
So it's the same with human and animals.
Ah, yes. See, that's why Dr. Kalgum has said how antivenom was produced. By injecting the venom into the horse, and in India, they inject it into donkeys. Donkeys also they use, and sheep also they use. But in Malaysia, we started in Perlis, in Kanga Snake Farm, producing antivenom way back in 1977, 78, 80, 81. 81, 82, 83 they closed because they found it is very expensive. They can import rather than producing there. So that's why now that has been closed down and been converted into some recreational area for different snakes. Okay, any questions? Yes. You're from FSK, you're Dr. You are the one last time we came with the model of snake. You're the one, huh? Actually, you have to be the one. Okay, go ahead. Mangrove snakes.
One thing that I notice is whenever I walk barefooted in swampy areas, especially near the sea, you get snakes protruding from the ground, and sometimes if you're not careful, it bites onto your feet. So I'm not too sure what species the snake is.
I can't answer the question because I spent a lot of my time at Puncak. When I was a schoolboy, going there, cutting the mangrove wood, etc. I didn't experience that.
Thank God I got somebody to line on.
Okay, it's a very interesting question because mangrove forest in our country is one of the most biodiverse and very important in terms of ecology. So we have a lot of snakes in this area, and the mangrove forest is not just by the sea; it's also lining the river, where we have the brackish water, and the fresh water meeting the salt water. That's called the brackish water. So you have a lot of mangrove trees in this area as well, and they do have a mixture of both what you call animals which are from the salty water and the fresh water. So the one that you see on the, I assume on the mud, you spin on the mud. There are two. One, it could be below. Okay. Could be other type of fish which in there, or it could be a crab eating snakes. Okay, possible. The crab eating snakes are not venomous. Okay, they are actually considered as brackish water, and there are several types. These are called the endangered species. The one that is very, how should I say, well known to cause problems is the mangrove pit viper. Okay, and these are a bit feisty. They are they bite at anything.
Unlike kapak bodoh.
Not bodoh. This is very feisty. It's more like Muhammad Ali. But it's actually interesting. You went during daytime to this area.
For
If you go out to
no,
the
I was not bitten, but
yeah.
I came to know about.
Okay, just to note that mangrove pit viper are mainly arboreal. You know what arboreal is? Okay, it means it's mainly on the trees. But during daytime, they will come down from the trees. Okay, they will be at the bottom part of the shallows. Okay, one possibly because of food, but I suspect most of the time is because of avoiding predators. What's predator from the top? Yeah. Okay. So they are hiding from the lung, yeah? From the sea eagles, and when they are down below, they are a bit more protected. But at night time, they will climb back up. That's where the birds are on the trees. And the birds are on the trees, and also some other animals. So these are the observations that I made.
The other question is, I presume elephant trunk snake is not dangerous.
No.
Coil and very strong.
Elephant trunk is a very interesting snake. It's a Acrocaudus species. There are only two of them in Malaysia. One is a small one, and this is Acrocaudus javanicus. This elephant trunk. Do you understand what I'm talking about? Okay, double. Come to the next course. But the elephant trunk is docile. It's not really venomous. It's purely aquatic. Means that if you lift it out of the water, the body muscle cannot sustain its posture. So it doesn't. It's different from a pit viper, which lives on the tree. You lift it, it will just go. Because it's a tree climber, so the body is designed for such. But elephant trunk is aquatic. It needs the water buoyancy to support its weight. Can grow quite big, about 2 to 3 meters long. Girth about maybe 20 centimeters. But it doesn't actually cause any issues to humans.
The other question is, have you encountered cases where there are fishes with radiated grade marks?
Yes.
Are there many cases in Malaysia?
No.
Are they in certain regions of Malaysia, in an island, for example?
No, it's in because it is occurring both in Selanjung and Borneo. We don't encounter many because it's relatively shy. Actually, all snakes are shy, except for Dr. Kandun. It's not in their nature to really bite and see people, but they shy away from presence of human. Okay. I was recently in Fraser's Hill. We went there because one of our friends apprehend one giant red-headed crane. We were there purely for the sake of the red-headed crane. It's about 2.5 meters long. Okay. And it's about 180 centimeters, so 1 meter, almost 2 meters long. But it's really big, and it's feisty as well. Well, it's not feisty, it's, it wants to, it's very strong, and it wants to get away. But we were there just to collect the venom from this thing. It was quite a lot of venom. Yes. The child, the 7-year-old,
Passed away. Okay, let's get his history and Mr. President history.
which history?
History from your side and the
Yeah. Yes. That's what I said. You don't have to wait 48 hours to die. Okay, so what happened was, ini recorded ke? Not kena recorded lah. Because this is a confidential. But what I can tell you is that the child was bitten while he was in school. It was during the waktu rehat. Did not tell anybody. The friends also didn't tell anyone. And then masuk kelas. Waktu rehat sekolah tak sampai setengah jam pun biasanya. Tak sampai setengah jam. So somewhere in between, went back to class. Collapse in class. Teacher did not do any CPR. Okay, this is very important because what we been trying to campaign, campaigning is the public needs to know two things regarding sleep and pandemic or first aid. First is to know CPR, okay, basic life support. And this is like for everybody, it doesn't have to be sleep out. But second couple is the sleep out first aid. So these are the two things close together. So in this situation, if the teacher knows how to do CPR, most likely the child can be revived while help is on the way. And the thing is that the teacher brought the child, called the mother first I think, brought the child to the clinic kesehatan. So that takes time. And the child probably died because of hypoxia, paralysis, cannot breathe. It's not directly affecting the heart also. Right? As I said, it's not a child, heart stops most likely because of hypoxia rather than issues with the heart. Okay? And they did do CPR in the clinic kesehatan, but after half an hour, no response, so they stopped. Okay? No response means the heart did not revive back, okay? After all the things that they've done. But the parents decided to take things into their own hands and bring the child to the hospital. So they brought the dead child to the emergency department, and they restart back resuscitation, but after half an hour again or 45 minutes, I think a bit longer, it was also stopped because there was no response. And that was prolonged there. And went home, and then the mother said the child was moving. So, then they had to call the hospital again and send the ambulance to reconfirm death for the third time.
What the lesson we learned from here?
Yes, most likely yes.
What we learned from here in Australia, all teachers
Must undergo this first aid. And I know, my daughter is there. They all learn all these things, you know. Yes. Something the Ministry of Education.
No, elaborate. I'm saying on one place, learning issue. This case is teachers must know how to do
Yeah, well,
and first aid.
well, most of us, it is the policy that each one of us should know a little first aid. And then we would have, like I myself is a first aid, qualified first aider, because you have to go undergo the training every year. We learn CPR and all this. But with the children, we taught them the basic things. We taught them about the dangers of wildlife. But although people were saying that Australia has got lots of wildlife and dangerous snakes and animals, but you hardly hear them. We got bitten now. You hardly heard of death cases. But we could get that in the outbacks, but not in the city, because people. Again, it's education. Education is an ongoing thing. That is actually active back in Brisbane and all over Australia.
Okay, any other questions? We are almost reaching the form.
Yeah, yes. Nama apa? Mana? Anis.
Kita banyak, kita tahu.
Okay, hello, Doctor. during my diploma years in UiTM Penang, a chemist told me that there are always cases where we can't identify the snakes that bite the people because no one knows. So what they do was like sinking the bitten part into the alcohol because it helped neutralize toxic. Is it a correct thing to do?
Say
Have you
again.
ever heard about it? Huh?
In Penang, they
Yeah.
can identify the snake was bitten.
No. A chemist told me when I was in Penang doing my diploma in pharmacy, my lecturer, a chemist, told me that there are always cases where the patient bitten by the snake, but we don't know what type of snake. So they kind of put the bitten part, maybe the hand or the leg, into the alcohol because it helped neutralize toxic. Have you ever heard about it?
This one is the, as I told you, the old folk stories what now we do. I'll ask something from another friend.
Very, very interesting question, and thank you for bringing up. It's adding, it will add on to one of the things that we've seen or know about the Bodo things that people screw up. I think that one, rather than putting the leg in the alcohol, might as well drink the alcohol. Yes, at least there's some benefit of the alcohol. And after that, the one with the technician also can drink some. No, it doesn't do anything unless you want to preserve the leg. That's what we do when we want to preserve snakes. We put in alcohol, 70%. It's too strong for drinking. No, it doesn't. Does that answer your question?
Yes, but the person that told me is a chemist and a lecturer.
And that's why he's a chemist.